Hi there. Hello, Ms. Melnikova.
Hello, Evgeny.
People living with diabetes mellitus, just like those without one, can sometimes catch a cold or even flu. Please tell us what should be considered in these situations to remain focused on the treatment target.
It's a very important question, Evgeny. Indeed, it may be very difficult to avoid infection. Any doctor would tell you there is no single behavioral pattern one should stick to at such time, as different disorders, different conditions can affect the blood glucose level in different ways, so treatment guidelines may also vary. What should we rely on then? We should be guided either by personal experience of a person with diabetes or by some kind of logic. Well, let's look at several potential scenarios. Suppose a person presents with a disease and the leading symptoms are gastrointestinal distress, vomiting, nausea, and diarrhea. Apparently, such disorder will largely impact the nutritional pattern. The level of carb consumption will be much lower than usual, and there is no guarantee that the carbs consumed will be properly digested and absorbed.
In some cases, you have no appetite at all.
In other cases, you have no appetite at all, and the food eaten or drunk is not digested. Do you think your blood glucose level will be affected? Is it likely that your blood glucose level is lower than usual because of the drastic change in nutrition?
Yes, it's quite likely.
If the carb consumption has changed, then the insulin level is likely to decrease compared to normal, and it may drop significantly. And this will primarily affect the so-called elementary insulin, ultra-fast-acting, prandial insulin. Therefore, a decision to adjust the insulin dose may only be made based on the data of blood glucose self-monitoring. Here is another scenario. A person has a viral infection, accompanied with cold, mild malaise, and a mild increase in the blood glucose level. The person's nutritional pattern is changing, but not as critically as in the first case. It would be logical to suggest that the dose of insulin could be reduced, but typically, any disease leading to fever will increase the body's insulin needs, and in this case, there is no need to hurry and reduce the dose. Once again, the key factor that the diabetic patient should consider when making decisions on treatment modifications is the self-monitoring data. And finally, the most serious case, and probably these particular conditions you meant when you asked your question: viral infections accompanied with fever, such as influenza or a very serious inflammatory disease, high body temperature, malaise, and a very high blood glucose level. In this case, even if a person cuts down on carbs, the dose of insulin is definitely not to be reduced. There is every likelihood that the dose increases, and the spike may be significant. This happens because, first, the body needs energy to grapple with infection, and it can be assumed that the carbs consumed by the patient with diabetes will be those with a high absorption rate. It means that these carbs will also require a sufficient amount of insulin. There is no one-size-fits-all formula, but we always warn our patients with diabetes that their daily insulin doses may increase by 1/2 or 2-fold or even more during illness. One shouldn't be scared of that. Just control the situation with more frequent glycemia self-monitoring, even at unusual time points, not just before food intake or before bed, but also additionally at night, in the morning, or in case the condition worsens or other cases like that. Urine ketones is another key parameter we have to focus on, in addition to hypoglycemia and a significant increase in blood glucose. What is specific about the behavioral pattern of a diabetic person during illness if such person has a high blood glucose level or ketones in the urine? What is your opinion? What's worse?
It's
What's more
probably alarming
serious?
when ketones appear in the urine.
Absolutely. Ketone bodies are a sign of significant insulin deficiency at the given time point, not just a lower insulin level. Therefore, more intensive efforts will be required to overcome the deficiency. Let's sum it up. Concomitant disorders are a significant contributing factor to the blood glucose surges. It's almost impossible to predict the effects of the disease on the diabetes management. The key method to take control of the situation is to perform frequent self-monitoring of blood glucose, and in some cases, urine ketone assessment will be required in addition to the blood glucose level.
Thank you very much for such a detailed answer, Ms. Melnikova. Now I know the parameters that require closer monitoring in diabetic patients with concomitant disorders.